go. Let's go. Good afternoon, good morning, no matter where you are. I know we have people on from all across the country and even some people from outside of the U.S. So we'd like to welcome you as we get started today, as we go deeper in our discussion. I appreciate Jerome using the word season. I felt a little old, but we have some seasoning on us. But although we're experts, we still have room to grow. So we encourage you to push us, to ask questions as we continue to grow around mental health, hope, and healing. So we look forward to it today.
Oh, am I supposed to go here?
Armin, it's on you.
I was just admiring my seasoning, salt and pepper that you and I share, but
it's coming. It's coming.
Corey does not, and Sherry does not even. I'm Armin Brott. I'm the author of a number of 10 books actually on fatherhood, and also work with a nonprofit called Healthy Men Inc. And we deal a lot of what we do is with men's mental health.
Sherry, I believe it's on you.
Okay, I'm Sherry Doherty, Program Director of Child Fund of America, Parent Help, and we offer free and confidential services for parents around the country on issues related to parenting apart challenges and preventing and resolving all categories of missing children. I believe Corey is next.
You're muted.
Thank you, sir. Hello, everyone. My name is Corey Williams. I am a licensed therapist and owner of Quintessential Wellness Solutions with offices in Massachusetts, as well as Cincinnati, Ohio. An award-winning author of the nonfiction book titled Thriving While Black, The Act of Surviving and Thriving in the Same Space, which explores the psychological and emotional consequences of being Black in corporate America. And we are here today to talk about the impact of paternal mental health on parenting, children, and relationships and fatherhood altogether. So thank you for having me.
All right. Well, let's get started. If you hadn't yet said where you're from, put your name in the chat, represent wherever your state or region are from, and let's get into this today as we do our best to help bring hope, healing, and health to those who we serve. Y'all, we know that we deal with a lot of issues around research as it relates to mental health. And so most of the research shows that 1 in 5 Americans experience mental health problems yearly. And it's been exacerbated even as of late. However, less than half of men, us, who report having an issue, a situation, or a problem, actually seek to receive treatment. So as part of the help factor, and for those who are on today, we're going to kind of categorize this, and we're going to deal with the help first. What prevents most men and fathers from assessing or accessing mental health services? What's the barriers that stand in the way? Shari, I hope you don't mind. I want to kick this off with you and help us go down the path of breaking through barriers and getting access to help.
Sure, I can speak to this from the angle of speaking with dads across the country, thousands and thousands for many years now. We've been operating since 1980. I have not been there since 1980. But we do see that dads sometimes are wary about advice and judgment, and there might be a misperception that mental health professionals are all about advice and judgment. So that's something maybe we can help them get past at times, understanding how mental health professionals actually can be engaged and what the process is and the purposes of it. There's a vulnerability to it, to letting go like that. And honestly, one of the problems we see very often is that dad might have people who are disempowering him accidentally by blaming the other parent or which would really mean there's no reason to go for help for fixing oneself. If there isn't any ability to improve the situation yourself by getting some help, by engaging a professional. So we do see that there is a hesitation there to seek out this as a remedy and to let go of whatever the fears or misperceptions are of the mental health world.
Okay, let's ride that word vulnerability a little bit. Corey, you've helped a lot of people in that area. I personally think that there's some good healing in being vulnerable. So from your perspective, Mr. Williams, talk about that a little bit if you don't mind.
Talk about vulnerability or the factor or the initial question?
Both. Put them together.
Okay.
Yeah.
Yes. Right. All right. So with regard to vulnerability, from what I've noticed in my practice, most men have looked at it as a weakness of being vulnerable, and have been apprehensive in the sense of kind of opening up, not feeling safe to be able to open up and allow their most inner thoughts and emotions to be expressed. With regard to the factors that you mentioned that may prevent fathers from accessing mental health, I would identify several factors. One would be stigma. Many men feel that seeking help for mental health for their mental health issues is a sign of weakness, as I mentioned, and may lead to societal judgment. And this can be especially true for fathers who may feel that they are failing as a parent if they require help. The next, I would say, just the overall lack of awareness. You know, some men may not recognize the symptoms of mental health issues or understand how to even seek help. And then we can say limited access, right? There may be limited resources in some of the areas, including mental health professionals who specialize in men issues. Another factor I would say would be cost, right? Mental health services can be expensive for some, and many men may not have access to affordable care or may have financial concerns about paying for treatment. And then the last, I would say time constraints. Many fathers face heavy workloads and family responsibilities, and which makes it difficult to find time to even seek treatment.
So, Armin, I want you to pick up there too, and I want you to, if you don't mind, I'm gonna throw another word in here, one that's not written down here, is also maybe address the pride issue with us.
Pride.
Yeah.
Okay. I'll see if I can get that in there. I think there are a couple. I think what Sherry and Corey said are absolutely right. Those are very important factors. I think that the whole issue of men and mental health starts from the time that we're little boys, where this whole thing about big boys don't cry, and later on it's man up. And when you start playing for a team, it's you get in there and take one for the team, play with your injury, whatever it is. That is built into us. And we don't ask for help when we're little kids because we're told, as Corey said, that there's something wrong with it. It's weakness. That I remember I was in the Marine Corps, and one of my favorite expressions that the drill instructors and everybody else would say is that pain is just weakness leaving your body. So just the whole sense is just man up. One of the things that we do at Healthy Men, which is healthymen.org, if anybody wants to check that out, is we look at what's going on with the healthcare system. And the healthcare system, unfortunately, is not set up to be terribly male friendly. And in the research that we've done, we found that a lot of guys don't go to the doctor for physical health reasons, and especially not for mental health reasons, because they just don't feel comfortable there. They feel that nobody there, nobody looks like them, nobody understands what they're talking about. And even the guys who do go, so Richard, you said that 50% of folks, men don't go and get help. Even the ones who do go, they find that the mental health professionals are not trained and recognizing the symptoms of mental health issues in men. A lot of the mental health screening tools that they use, the Beck's inventory, and there are other ones, a lot of the mental health screening screens are set up to flag symptoms that are most commonly found in women. Crying, feelings of worthlessness, things like that. And what happens is that so many guys who do go try to get mental health help, they get steered off into anger management when they're really suffering from depression or anxiety. And then to work in your word pride, there is a certain pride that we have as men generally, and as fathers, as Corey said, in knowing how to do things. We put everybody else's needs first. We take care of everybody else. We don't have problems. And it makes us feel good to feel that way. It also ends up causing a lot of problems. But there's that initial sense of, I don't need anybody's help. I can handle this on my own. That's what men do. And I think that that's a very, very valuable thing, a very valuable mental health coping mechanism in certain situations. But as I'm sure we'll get to throughout the rest of this webinar, it's counterproductive in a lot of other situations.
Yeah, I appreciate that. You brought something that came to mind, that you brought a thought to my mind. So I'm a little old school. We didn't check everybody's ages on the webinar, so we don't know how old we are. But
Let's
I
leave it
grew
at
up,
that.
I grew up in the time, and I'm sure y'all remember. Y'all remember the cassette tapes? You know,
Oh yeah.
yeah.
Remember
Not 8 track.
8-tracks.
I'm not going back that far, but just
Not
a
8-track.
little, yeah. Just a little cassette tape, and and I had a few that were my favorite, but every now and then the tape would kind of get outside of the cassette.
Yeah.
And I knew if I could wind it back in there before it got too far away, it would be all right. But every now and then it got stuck inside, and I went to pull out the cassette, it had totally unwound. And where I'm going with this is, I think a lot of us, if we go get the help while just that little piece is out, then the help is easier to access. We're not as far down the road. And Armin, I think you brought up a critical thing, is that, yeah, we got some work to do as practitioners, being able to recognize that. Because I can tell you, you're right, anger management. Oh, go to anger management, or it's purely situational depression. And so I'm going kind of to our second point here is, what are some of the factors that you believe, Corey, I'm gonna come to you first, that may impact a father's mental health?
Factors that may that may affect the father's mental health.
Yeah, that maybe start the unwinding process, if you will.
Gotcha. I would say some factors would be relationship dynamics, right? So the quality of the relationships, the quality of the father's relationships with their partner, with their children, and other family members can have a significant impact on their mental health. Work stress, right? Work-related stress can have a negative impact on the father's mental health, especially if they have long working hours or a high workload, financial stress, all right? Financial problems or difficulties. These difficulties can also have a negative impact on the father's mental health, but also parenting responsibilities,
Yep.
The demands and the pressures of being a parent can cause stress and anxiety, especially if the father feels that he's not coping well or not doing a good enough job as a father. I would also say social isolation, right? So that lack of support or community, can lead to feelings of loneliness, depression, and then more importantly, unrecognized previous health or mental health issues, right? Unrecognized previous mental health issues. So fathers who have a family history or a history with regard to themselves of history of mental health issues are more vulnerable to experiencing them again, especially during times of stress, of high stress and change. Yeah.
Armin, pick it up from right there. Pick it up right there.
I think that what Corey said was absolutely right. Those are very, very important things. Finances and lack of confidence in one's own abilities, which comes in many ways from a lack of resources and a lack of support. So a lot of this stuff is starting further upstream. I think you mentioned pride before. That I don't know if it's exactly the flip side, but there's a sense of shame that happens, particularly for fathers who are single fathers or divorced fathers who are not living with their kids. If they feel that they aren't able to provide for their kids, either financially or any other way, that leads them to back away from, and sometimes abandon, I don't say abandon, but not be as engaged with their kids as they could be or as they should be. And then they feel it gets into a loop. They feel like bad fathers, and then they don't want to be there because they're bad fathers and they feel embarrassed. And this sense of shame, though, is huge, particularly among low-income fathers who feel that they aren't able to provide. They can't even put milk in the refrigerator for their kids. And what does that mean? What kind of a man am I if I can't even do that sort of stuff? I think also something that gets overlooked is when a dad, particularly one who doesn't have access to resources, when he's got a special needs child or he's got a child who's difficult, that can completely undermine your sense of self and your sense of confidence in your abilities. And then one that we don't talk about too terribly much, which is that there's a whole bunch of literature about this stuff, about maternal gatekeeping. When the father does not get support from the mother, when she says, "Oh, you don't know how to do it. You're not doing it right." When that kind of thing happens, that completely undermines the dad and his relationship with the kids and his confidence in his own abilities. And those dads end up becoming mommy's little helper instead of an engaged, actively involved dad that the kids need and that he needs too.
That's very interesting. And Sherry, but before I come to you, I want to, since I'm gonna throw some curveballs in here, y'all. All right. So between some of the things you said and Corey with social isolation, oftentimes we're dealing with men who are trying to give something they never got.
Mm-hmm.
And so,
Yes.
and a part of that picture is, and I want to give you this term, and we can deal with it any way you like. Sherry, if you want to take it, you can. If you want to say, somebody else, you can pass it. But relational poverty, as it relates to mental health, I didn't have this as a roadmap in my life. Now I've produced something that I'm trying to live up to or trying to give out, but my well is actually empty. And so how do I deal with my future not having any past to pull upon while living in my present? That relational poverty piece, which is really fatherhood's biggest thing. If I were locked out from my own father and now I'm locked out, it's what you said about maternal gatekeeping, Armin, and now I'm locked out there. I'm sitting on this island of social isolation and I find myself in relational poverty. And our most dangerous things are the thoughts inside of our head. So Sherry, you answer phone calls from all across the nation. Do you ever feel any of that?
We do. We absolutely do. We want to know who this dad is. And so we see here that adverse childhood experiences, ACEs, as you're saying, Richard, what does he bring from his childhood forward? When we look at ACEs, a lot of our callers have experienced a high number of adverse childhood experiences, and we know what those can be now, and we are developing protective factors for them. But we also know that they are very often directly related to mental health crises, substance use, even mental health diagnoses later on. So it's true, they don't absolutely just appear one day. These dads who come to us have a history. And the other issue would be the break in a relationship can cause an exacerbation of emotions, negative emotions. So sadness is depression, anger is rage, mistrust is paranoia. So like everything goes to 10, 11. And it can be brief, but that can go on indefinitely, unfortunately. And we know what happens with the brain when there's a break, and we know what happens with the heart, which could be literally a broken heart, which is cardiomyopathy, which is the medical manifestation of a loss. Add to that challenges to his stability, his status quo, his financial security, the relationship with his children. And when there's ongoing chronic or toxic conflict between the two parents living apart, there isn't a safe healing space anymore, because it's almost like, you know, he's batting away all these balls coming at him that come, again, some from childhood, some from this particular relationship that he's grieving the loss of, or the lack of access to children, which we're very, very careful to be wary of where we want to go with that one. We don't know who this family is. And so therefore would never make an assumption that there's a label that we can put on the other parent. We want to know who this dad is, and we want to talk with him in a vacuum and find out what the dynamics of the situation are, and empower him to bring some of those skills, build some of those skills, at the same time addressing whatever it is that's keeping him from seeking out good mental health services.
That's good. That's good. And I'm glad you brought ACEs in, and you did say what it means, just for everybody who may be on that. Stands for Adverse Childhood Experiences. And those are really around protection factors. And so if someone was not protected as a child, they may not even know how a good response looks as a father to actually protect. It's the provision, it's the protection, and those type things. And so those childhood experiences, if you're not careful, you will pass them on, and what's abnormal becomes the norm. And so we find ourselves, and one thing I noticed, and Armin, I'm getting ready to come to you, and I want you to kind of tie what Sherry said and what you said about co-parenting in a second. What I've seen, some of the most manic, some of the most depressed men I've run across were men who did not have a father, and they end up having a child. They wanted to be a father, and they get locked out from the opportunity to be that father. And so now I was locked out from having a father, and now I'm locked out from being a father. And here comes the big F word. So I feel like a failure. And to walk around with the guilt of being failed historically by my parent, and to feel like a failure because I can't be there for the people who I believe I should be there for, even though I may struggle with how to do it. But it's another thing to not be able to do it, particularly around, so I'm kind of going to this co-parenting thing, Armin, you know, how can the mental health of fathers impact their co-parents and their children?
Before I get there, let me just say one thing, which I think is very important. I bring this up with the dads that I work with, and I imagine Corey does too. That this whole idea that the apple doesn't fall far from the tree, or that because you had a poor relationship with your father, or because your father was not a good role model, that you're destined somehow to repeat that. You are not. That we are able to, I think, if we're talking about mental health here, we are able to make a conscious decision, and we may need resources and we may need help to get us there, but we're able to make a conscious decision to say, this is something I am not going to do. I'm not going to look to my dad as a role model. I'm going to look to other role models, or other places to get support. So but again, I mean, it's not guaranteed that everybody's going to be able to have access to resources to get that done. But in many cases, it can be, you are not doomed to repeat the sins of your fathers, kind of thing. But as far as the relationship with co-parents, I think the most important thing, I think there are a lot of research about this, what we're concerned about here, even though we're talking about fatherhood, is the health of our children. And the father's mental health affects his children's mental health. and the children's well-being. And one of the most important predictors of how well children are going to do is the relationship between the parents.
Mhm.
And the fact that you may hate your ex is really irrelevant. Be a grown-up and learn to respect your ex. And because your child, they, until they're teenagers or maybe even beyond, they have a tendency to look at everything that happens in the world as with them being in the center of it. So how do they want to know how this is going to affect me? They see themselves as half mom and half dad. And if dad is criticizing mom all the time and saying what a loser she is, then the kid's going to say, well, you're talking about me too. You're saying I'm a loser too. And if the same thing goes the other way, if mom is saying dad doesn't know how to do anything, or he's got this girlfriend coming in and out, that's criticizing the child. So the relationship between the parents should stay away, as far away as possible from the children. That's the first thing, is that you don't have to like each other. You don't even have to see each other, but you do have to agree on some basics, which is that you put the kids first. And you need to bring in a mediator if you have to be able to come up with a plan that you can both agree with. I think that that's really the most important thing that parents can do, is to whether they're living together or not living together. I mean, parents who live together have plenty of problems agreeing on stuff, and it's an awful lot worse when you got parents who don't live together or are thousands of miles apart and can't see each other. But you don't like your ex spouse, whoever, whether it's he or she, that's fine. You can still let your kid get on Zoom to talk to his dad or his mom, who's 2,000 miles away, and that's it. And your child will love you more for it. Basically, that they at some point they will realize, you really helped me maintain a relationship with my mom or my dad, instead of going down this rabbit hole of how horrible he or she is.
I appreciate the fact that you said kids look at themselves as half mom and half dad. Even if we looked at the word mother and father, the end of them both have he and her in it. Like if we could get that simple, we could he and her. Yeah, it's so I believe children really do look at it. Corey, let's go down this practical road. Let's get to the healing side of this situation. What's some systematic, concrete steps maybe that you could help provide us today that fathers can access mental health services to move toward the healing?
Sure. In my practice, I traditionally would suggest to clients who are trying to, well, we're trying to seek out mental health services, but don't really know the process as to how do they go about doing it, or there may be a family member or a loved one reaching out for a father or a male who doesn't know the process. So I would always suggest that if I don't have availability, right, that they start by talking to their primary care physician, right? That their doctor can assess their mental health and needs and refer them to other mental health specialists if necessary. I would also say, contact your insurance providers. They can provide a list of mental health providers that are covered by the insurance if you have insurance. And I would also suggest to research local mental health clinics or counseling centers, right? Many clinics and centers offer sliding scale options for financial assistance for those who may not have insurance, right? Utilize teletherapy options. Many mental health providers offer online counseling services that can be accessed from the comfort of their home, and that reduces that fear of going into someone's office. Check with your employer. Some workplaces offer mental health services as a part of their health benefit packages, right? Reach out to support groups in your community. There are many support groups for dads that can provide a sense of community and emotional support. I would just suggest that to dads, taking care of your mental health is just as important as taking care of your physical health, right? So, don't be afraid to reach out. Don't be afraid to ask for help when you need it.
Yeah.
Amen to that. And let's deal with our I don't even like to say the word pandemic, but our viral situation historically that we're still on the edge of, and that we've dealt with really for the past 3 years. So hopefully I don't have to say what it is, unless you've been under a rock somewhere and don't know what's going on. It's been a virus out here, and so I want to share, because you field calls and you're part of this work. Did the calls go up during the pandemic, and how did that impact fatherhood, programs and services and access? I'm headed down the programmatic model. I know we got a lot of practitioners on today, and what did you see, particularly coming out of in pandemic and with fathers and fatherhood organizations?
Okay, thank you. I can definitely speak to how Parent Help experienced that over the past few years. If I could, though, even though Corey did such a comprehensive job of talking about steps to get services, by the way, for dads to engage mental health services, we also are discovering the growing modalities of mental health services, and that there's some creativity for dads, moms who aren't interested in things that maybe they have these preconceived notions about. So there's equine therapy, there's arts and music, and there's somatic therapy, hypnotherapy, all different types, EMDR, trauma therapy. So one thing I just wanted to add to that would be to open that door, and just so their options become available, because there might be something that this particular dad is a little more comfortable with than sitting in what a traditional setting might be. It's work. It's a lot of work. But as for COVID, conflict amped up in our estimation. It wasn't necessarily things were terribly different. There was one additional element, I think, that people were dealing with, that we were having to figure out together, which was that denied access due to differences in immunization, mask wearing within families. Those suddenly became apparent, things that never were considered previously. So suddenly we're dealing with two different attitudes and fears of additional relatives getting sick, the grief associated with lost relatives, with suddenly blame and that kind of anger connected to that kind of grief and loss, heightened anxiety about health, about work, about school, finances and housing problems started to rear their head. And basically, well, we also do runaways and thrown away children, and those numbers went through the roof. But we did see heightened anxiety, and therefore heightened conflict, but also obviously mental health crises with people, with the fear that comes along with this unknown element and this unknown future became apparent. So it got intense. It got I won't sugarcoat it. It got pretty difficult, because again, we didn't have that experience. For fatherhood practitioners, mental health practitioners, we had for the courts, child welfare. So I think we were all treading water together for a little bit.
And so you said conflict went up, and I believe that I've seen the divorce rate spike a little bit and those type things. And so I want to ask a question right here. Has work, leaving the house, going out, open up ways for people to avoid the things that were really going on? And now that I'm in this space and I have to deal with he, her, I have to deal with my kids, and we have to do that. And I'm used to waking up in the morning and see ya. see you after work and after happy hour and when I get ready to come home. And all of a sudden that's not there. And now we have to really do what humanity should do best, is to communicate and to deal
Yeah.
with each other and to look each other in the face. So Corey, did the virus open the door to openness and expose some things that were there and reveal some things, particularly around mental health and families and family structures?
Absolutely, absolutely. Even within our practice, from the time that COVID hit, I would say it was a 75% increase in clients seeking couples therapy. And, I always suggested that um, COVID forced married couples to be married couples, right? Traditionally, we get roughly 3 to 4 hours of engagement time as a couple if we're working, a regular 9 to 5, Monday through Friday, not including the weekends. You may work the weekends, but COVID, with the closures of work, closures of school, COVID forced couples to do exactly what you said, and that was to engage, right? Communicate, right? Navigate conflicts in more healthier manners. And it really just kind of uncovered, the problems that couples were actually experiencing. COVID truly put relationships, marriages under the microscope, right? And force the individuals to really explore, are we truly, you know, good together? You know, is this a forever thing? Right? Is this just a reason, season, and lifetime based relationship? You know what I mean? And so yeah, I definitely, like I said, I definitely think that with the pandemic, it really forced, couples to really learn to navigate conflict, learn to navigate or establish or develop, better communication skills with one another. Those that really chose to, stay in it and fight for their marriage. Yeah.
Armin, you notice anything during this past few years?
Well, I think, yeah, everything that Corey and Sherry said is absolutely correct. I think there's also another part of it, which is that a lot of parents, particularly dads, had the opportunity and the corresponding difficulty with becoming hands-on parents for many more hours than they were used to. I mean, as you were saying, Richard, you get up in the morning, go to work, as most guys do. You see your kids in the afternoon, you spend time with them on the weekends. But when kids were out of school for a year and a half or 2 years, and dad may be out of work, that's people who are going to be spending a lot more time together than they had ever planned to. I mean, they probably planned to in the back of their mind. They said, I want to be an involved parent, or involved dad or mom. But then all of a sudden you're thrown into it and you got to spend 8 hours a day figuring out what to do with your kid. It can be difficult. And there are people who had difficulty with that, who had problems with it, they weren't prepared. And there are others who found groups to get together with and meet and share resources. And homeschooling became a thing. And I mean, it already was a thing, it became a bigger thing. But getting a curriculum that actually told you, okay, here's what you can do with your kids throughout the day, and here's how to teach math, and here's how to have your kids read a book and do a book report over dinner, something like that. It gave the opportunity for tremendous growth and development. And I think probably nobody would say, gee, I wish we could keep on this COVID lockdown regime for another year or two. But I think a lot of people would say, we really learned something, and we're stronger for it. It's the whatever doesn't kill you makes you stronger kind of thing. So yes, there were those who fell into the cracks, unfortunately, and did end up getting divorced or something, or breaking up a relationship because they just realized they had nothing in common. But that kind of thing happens sometimes when you become an empty nester. You get the middle-aged mom and dad who say, well, now what do? We got this big empty house and there's no kids around, and you realize we haven't had anything in common for 20 years except the kids. And now they don't need to be taken to soccer practice. Well, we can get on with our own life. So that's, I think, a minority. I think the majority have turned it into a positive learning experience and developed skills, and they're better and more respectful. And I think what's interesting is a lot of those skills about what you learn from spending time with your children about being flexible, understanding that people make mistakes and it's not the end of the world. When people go back to work, they take their skills with them and they can implement them there. And I've heard from dads who are managers who have gone back to work, and they find themselves being a little bit more flexible with the people who work for them about missing a deadline, or understanding that, sometimes just weird things happen and not everything is going to be on exactly the perfect schedule. I just want to throw one more thing in there to the very comprehensive list that Corey mentioned about where places to get services. I think if you are anywhere near a university or a college that has a mental health program, the students usually need to get hours to get their license. And those hours, the students are becoming therapists, but they are always supervised. And so you can get in often to see somebody who's a student, an advanced level student, for very low cost or free. And also, Corey mentioned this, but I want to emphasize, groups are really important. I would say, and I hope this doesn't come across as being sexist in any way, that it's especially important for guys to get together with other guys to talk about parenting and mental health issues, because it gets back to that shame and pride and vulnerability thing that we talked about before. I've found in the classes that I teach for fathers that if there's a woman in the room, guys just don't talk. They don't want to be vulnerable in front of a woman, but they'll generally, once we get past all the sports talk, they'll start talking about their kids and their relationships in a very open kind of way. So if you can find another dad or two or three and go have a beer and talk about life, it can be really a wonderful thing. The first time may be a little uncomfortable, but I found that guys really enjoy it and find great benefit in it.
I would say amen and amen to all of that. I may substitute the beer for Sprite, but one thing that we learned, particularly in South Carolina, particularly a lot of the non-custodial fathers, all of a sudden became custodial fathers during the pandemic, because she may have had a job and she had to, and may have been an essential worker. And it was like, daycare is closed. Here's your opportunity. And so, Armin used the word learn several times, and a lot of the things that we do learn, we have to earn oftentimes. That's why if you take the L off, it actually spells earn in that mode. So I think there was a lot of, if you can frame our viral situation correctly, you will find there was a lot of golden opportunities if you took care of them. Like something simple as child support court is closed. Go get some stuff together. Down here it was closed almost 2.5 years. So what can you do in this situation to take advantage of that? So as we go down, the healing side into the hope side, we're kind of going to shift to the programmatic piece. And so kind of the question is, how can fatherhood programs best understand and address mental health issues? Knowing that fundamentally, and that's why, Armin, the point you brought up was great, because I was one of those guys that had to get my hours in order, to get my master's, all that kind of stuff. But a lot of organizations aren't fundamentally structured for, I would say high level mental health. And I'm not talking about all the deep clinical stuff and schizophrenia, all the stuff that's in the DSM-5, but there's a basic baseline where you should be able to recognize things like, basic health. Is he combing his hair? Is he brushing his teeth? When I drop him off, is he always telling me to take him somewhere else? When we have food at group, because group is critical, Armin, does he eat more than anybody else? Is there a hunger? What are the antennas that need to be up, particularly in fatherhood organizations, so when the guy does not say it, we can still see it? Corey, anybody jump in?
I'll go. One of the things that these fatherhood programs, as you mentioned, that they can do to raise that, address mental health issues for fathers, they could raise awareness, right? Put more effort into raising awareness. So fatherhood programs can start by raising awareness about mental health issues with fathers. I mean, they can essentially provide information about the prevalence of mental health issues among men and how they can affect fathers. They can help in the process of reducing the stigma, as I mentioned earlier. Fatherhood programs can help reduce most of the stigmas associated with mental health, right? Many men feel shame, as we identified earlier, or embarrassment when talking about their mental health. So at the very least, by reducing the stigma, fathers can be more open about their issues and seek help, right? Provide more education and resources, so fatherhood programs can provide educational resources on mental health, such as books, videos, podcasts, webinars, and provide this data, this information to fathers. Fathers can also be provided with practical resources, such as contact numbers for mental health professionals, or online resources and services in their local area. Lastly, I would say they can initiate something that promotes some level of healthy lifestyles for fathers. So fatherhood programs can encourage fathers to adopt healthy lifestyles, which may include healthy eating, exercise programs, sleep hygiene, stress management, substance abuse counseling, in efforts to help with avoiding drugs and alcohol. I think by implementing these strategies, fatherhood programs, they can help fathers help fathers to understand and address mental health issues that seemingly lead to better outcomes, not only for themselves, but for their families as well.
Yeah. So, and I heard you kind of do the, who are the people in your neighborhood? In other words,
Mhm.
like no good fatherhood program, and anybody feel free to jump in after this, you can operate in isolation. In other
Mhm.
words, do you have enough net in your network to serve the men so they won't fall through the cracks? It's not that you have to be all inclusive, but you should know what's available, who's available, and be able to recognize. Here in South Carolina, I know that we did a lot of ACEs and trauma-informed care so we could heighten the awareness of what to look for. And my thing is, you can't serve people blind. You have to be open to the whole experience. Can they keep their word? How do they walk in? What's their appearance? Are they consistent? Do they have mood swings? They like this one week and like this the next week? Are they going from one coast to another psychologically and emotionally? And another approach that we actually took, we took what we call the top-down approach. So we started with the mind of the man and the body of the man, and then what he puts in the body, the nutrition of the man. And then we literally did something simple as a grocery store tour. So we went to healthy eating, active living, and then we went to exercise, because a lot of the people who are actually suffering from mental health issues is because y'all know how it is. You stare at it so long, it is now taken, the thing that was small is now going into Goliath form because you have no off ramps. You don't do anything else. Go for a walk. I think sometimes we make this stuff really, really complicated. I don't know when the last time anybody on here went down a slide. I went down one a few weeks ago. But sometimes we make life so complicated we forget the simplistics, and the simplistics are actually what keeps us healthy. Going for a walk, getting on a merry-go-round, those type things, and making sure fatherhood programs can allow people to do those things that they would not normally do, and putting group, on top of that. So,
Can I?
go ahead, please.
No, I was going to say, I think that what we're talking about is really important. I want to get back to this idea I mentioned earlier about the system itself and the changes, some of the changes that need to happen in the system. We talk a lot about cultural sensitivity in a lot of areas, and whether that's racial or religious or gender. We need to look at male having a culture that's culturally sensitive to men and boys, and that is set up to actually serve those people, is incredibly important. There is, unfortunately, folks who are in the trenches and people who are listening can probably speak to this more than I can, but I know from the research that I've done, there's a tremendous lack of male mental health providers, particularly men of color. And in low-income areas, the guys are not going to show up to talk to a woman. I mean, it's not that women are any less capable, but it's part of the pride thing, part of the I'm a guy thing. And having and training and supporting and recruiting, I guess, is where it starts with. But providers, mental health providers who are men of color, I think is going to be incredibly important for a lot of the mental health systems that are out there. Is we've got to get that going, and we've got to have role models. And it's important within a group to talk about your own mental health struggles. And we've all had some kind of mental health struggle. We can do that as a glass breaker or a conversation starter to talk about our own things. And I think also to perhaps look at examples that are outside of your scope. I do a lot of work with the military and interviewed a lot of people for a podcast that I do on parenting for the military stations. And the sergeant major of the Army, who was it's the highest enlisted person in the entire Army, was very open about talking about his mental health struggles. He suffered from anxiety and depression, and to have a guy like that talk about his struggles is incredibly important, and it basically opens the door for other people who are below him and people outside the military to see that asking for help is not a weakness, that asking for help is actually a sign of strength. It shows that you need that other people are counting on you, that you've got responsibilities and you can't do that alone. And so asking for help in an appropriate way and accepting the help is a sign of strength. And we need to make sure that the people that we're working with, the men and boys that we're working with especially, have got that idea drilled into their heads that there are people who are suffering from the same kind of stuff that you are, or maybe suffering is not the right word, are dealing with the same kind of issues that you are, and it's overcomable, if that's a word.
Yeah, it's good communication, whether it's a word or not. It's good communication. I know exactly what you mean.
Can I, Richard, I believe
Yeah,
you
please.
said that your group became trauma informed, trained in basically, I think that was a really, really important point to make, is that for those in the field who are not mental health professionals, who still become trauma informed, that's easy enough. The CDC website has a great list of how to do that so we don't accidentally re-traumatize people. Crisis response training, suicide crisis response training is great for everybody. I had to use it a couple of weeks ago at work. And thank goodness I had the training because it came up. And since there's almost 300 diagnoses in the current DSM-5, the Diagnostic Statistic Manual, I would say that practitioners should defer to mental health professionals when it looks like someone needs clinical attention on top of all the other wraparound and all the supports and all the other problem solving we can do. Is that we have to, the greatest kindness, I think, is when we say, I'm sorry, I'm not a specialist in that, but I'd like to find a resource for you.
Amen, amen, and amen. That's why I think structurally you ought to be built like that. And
Yeah.
in other words, I've never put a stop sign in, but I know what they look like.
Yeah.
so I know what to do when I know what to do when I see it. But I want to ride the same thing. You know, even Army Corps, any trainings or something that you would suggest that, like, you know, if you're in this atmosphere, if you're in this field, take a look at this. It would help sharpen your saw.
Well, I guess in an act of selfless or shameless self-promotion, healthymen.org is the company that I mentioned. It's a nonprofit. We have a training program that we're actually piloting. We're just about done with the pilot program in Tennessee, which we're training educators and providers on exactly this, on how to deal with men. How do you set up a system where that will enable you to recruit men and boys into your practice? How do you deal with them once you get there? That if you have a program that's for girls and women, you can't just paint it blue and say, okay, we're going to do the same thing for men. It just doesn't work. You got to have different approaches to deal with men and to get them in and to get them there, which may mean having better hours, having weekend hours, having evening hours, having, reaching men where they are. We found that people were we would have mental health and physical health issues or resources for people at NASCAR races, where there's all sorts of donuts and beer and all this stuff going on, and people would say, "How could you possibly be talking about health in that environment?" And you say, "Well, what better environment is there to talk about health than an unhealthy environment?" But that happens to be where a lot of guys are. So we talk about that. And if you were interested in that, you can email me. I think my email will show up somewhere on here, or just look at healthymen.org and drop us a line through there. I can give you more information, but I don't want to take up too much time with that thing. But it is a program that's designed specifically to do this.
Healthymen.org. Mr. Williams?
Yes, I'm sorry. This froze up. We're doing final thoughts, I'm assuming. It froze up on.
We were saying that there's any training or anything you would suggest that, if you're in a fatherhood organization situation, that you might want to say, take a look at this, or anything, a particular skill, anything that would help practitioners sharpen their saw.
I see. Okay. Just to piggyback on what Shari said, I think trauma-informed care is very important, especially when you're dealing with the populations of color. So understanding racial trauma, understanding the systemic concerns regarding racial trauma, socioeconomic, understanding different socioeconomic backgrounds. One thing that Armin said is that that practitioners of color, men of color, seem to be far and few in between. And I find that to be very true, considering the uptick of requests for services, and specific requests for services wanting men of color, right? And it's just not people of color making this request, right? And so more outreach to universities and promoting the opportunity for, for aspiring clinicians, men of color, women of color, wanting to get into this field, offering internship opportunities, offering resources of that manner. My goal is to try to ensure, or try to educate more practitioners from the community that I'm from, and various communities that I'm trying to expand to be more help agents, right? To create more help agents within these communities. So that would be my take.
Okay. So I know we're getting close to the Q&A time. I know Jerome's over the chat. Chat's too small. I can't see it. But as we head to this, if you had to leave one critical thought around what we've been dealing with on today, I'm going to do the male thing. Start with ladies first. If you had to do one critical thought that you would say, you know what, I kind of want this to be a takeaway from what we've been talking about and dealing with and discussing on today. So Sherry, we'll start with you, and Armin, we'll go to you, and after that we'll go to Corey.
Okay.
Yeah, sure. What I'm getting from all of this is there's an extraordinary community, and sometimes it's invisible, or it's unreachable in someone's mind when you're alone and struggling and don't feel like there's support. And from what I'm hearing, there's great support. There's really, really good resources out there. I would say that finding appropriate and legitimate and adequate, well-skilled resources, referrals is vital, because if somebody gets a bad referral, that could be it. That could be the last time he makes a phone call. And so what I'm getting here is that there's this nationwide conversation that some people unfortunately are unaware of and aren't plugged into. So it's encouraging. It's just really heartening to hear how people are addressing the need. And the other is to remember that the most perfect parents don't have any children. So it's to absolutely is to help people just relieve themselves of that burden of being perfect or of, the fear of being judged inadequate. So I really appreciate the perspective that I clearly don't have, which is men working with men, but I just really appreciate just the care and consideration that the other panelists and everyone here has.
Now, I'm not going to let you die. You would have not been at the table if you didn't have any food to bring. So stop that. But no, we appreciate what you, and I don't want people to miss what you said before we go to Armin. A bad referral is a death sentence sometimes.
Yeah.
And so I would, if I had to fire a warning shot to fatherhood organizations, be a tour guide, not a travel agent. Don't throw a referral over the fence on somebody who you don't know, have not seen. You just saw their name in a phone book, or you saw at the stoplight and saw a post on a pole. In a word, you should know who they're going to see. You should know who that person is. You should know their skill set. You should know their specialty. It's just like a lawyer. If somebody's going, for a divorce, you don't send them to an accident lawyer. Unless you're just going up with a big accident. But that's critical what you said, Shari. In other words, that the referral, get that referral right, because you can actually end up doing more harm if you send somebody to somebody who does not have a specialty, that does not know or does not even have a relationship with the organization, who can communicate even back how's the help and how's the healing. That you should be in some type of contractual situation that you can at least be willing to share. Particularly, really should be the man sharing the information. But if the organization has a relationship to say he's growing or he's moving, certain things we can't share. But there's we at least shared that he showed up, that he's still coming. Those are some of the basics. So that was critical that you said that, Armin.
Well, it's been great to be with you. The three of you have so much more practical experience than I do. I have some practical experience, but a lot of it's theoretical and looking at data and research and things like that. So to hear from people who are actually in the trenches, so to speak, about what's going on out there. But I think, Richard, you got such a wonderful way of coming up with these catchy little phrases, or even just focusing on single words about vulnerability. And Corey mentioned isolation. And I think for us to think in those terms, that sometimes you just focus on one word and you can have a different perspective on what's going on. I think also the need for understanding and the need for that we all have, whether we're experienced practitioners or not, to educate ourselves about what's going on and about how we can do better and about how we can change the system. Because what we're trying to do, again, is get back, we all agreed on this, the kids are the focus of this thing. Yeah, we want fathers to have much more skills and to have better mental health, but that's going to help kids. So if we can keep focused on that part of it, it's going to be really, really important. Sorry, somebody just walked in.
Mr. Williams.
I would say fathers, please recognize the signs of mental health issues, okay? And the toll it can take on your parenting, your relationship, and children. And do not hesitate to seek help for yourself or for someone you love, right? Practicing good self-care is essential for managing stress, anxiety, depression, and there are always options available to those who need it. So reach out to your doctors, reach out to your local hospitals, primary care clinics for information about mental health providers in your community. And for the couples, those who are in relationships, I would leave you with this one caveat. Put less focus on always trying to get on the same page and just try to get in the same book at the very least.
I just add one more thing. I got a little knocked off kilter there for just a second. I think we also need to just, as individuals and particularly as fathers, ask people, when you ask people, how are you doing? Actually expect an answer from them. That really, how are you doing? And, you know, because I had this conversation, we were trying to come up with a catchy campaign. We should have got you involved, Richard, but "You okay, bro" was what we were coming up with. And the idea was that, you know, if you're not okay, I'm not okay. And so having these conversations, just man to man, father to father, are going to be really important in helping people deal with it. Because, like it or not, a lot of guys are not going to go to groups. But so we need to be able to deal with this on an individual basis as well. But asking each other how we're doing and being honest about it and talking about our own struggles is going to, I think, empower, to use Sherry's word, empower men to take the steps that they need to take to get better.
And,
Can I just add that
please.
that's a great point, and I learned this through having three girls, teenagers at the same time. Was my door is always open, but I promise I won't give you advice, and you might get flooded, but not giving advice, and learn through, as a mediator, learning the difference between listening and deep listening. It's extraordinary how somebody might come to you if you promise to just be a resource rather than a feedback necessarily.
Number one rule of therapy: 2 ears, 1 mouth.
Mhm.
So I would just say, as someone who grew up at my grandmama's house in South Carolina, treat your mind like a garden. You know, and my mother used to tell me this, and I can't help but almost end with her, that my mind is a garden, my thoughts are the seeds, the harvest will be either flowers or weeds. Cultivate daily. And that's how we create health. If it does not belong there, pull the weed quicker. You know, a thought is like a bird flying over your head. It might something might fall out the bird and hit you, but you can stop it from building a nest. So and that's how we cultivate our thoughts. So Jerome, I think we're taking it back to you, man. And if there's anything we need to deal with in the chat, we're ready. Thank y'all so much. Appreciate you.
Thank you.
All right. Diving into our questions, I'm just going in order as I see them and making sure I get to all of them. As I'm speaking, you can also put them into the Q&A function of the webinar. So I believe this question was directed to Sherry earlier back in the conversation, but I forget the context of what we're discussing. But can you share any experiential learning activities that have been used in small groups for men to create mental health discussions?
Oh gosh, I can. That might be too big to discuss here. So is this in the context of training, I take it, where
I forget, but
we work on the phone, one-on-one with parents, dads, moms, other caretakers, and I do travel and train, but that's usually for professionals. A lot of experiential stuff there. So I think that since we're really phone-based, I don't know that I'm able to answer that really effectively. But we do a lot of fun stuff in our trainings. I can tell you that.
Well, yeah, just moving along the next question. Are there statistics on the benefits to children who have an involved/engaged father? That was just for anyone of the panelists.
Yes,
Oh,
there are.
There's tons of it. Yeah.
I would tell the person who put that, I would tell them, Ron, they probably need to email us directly. We can get the matter of fact, that's what the clearinghouse is all about.
Yeah.
So I would get on this website, and we are obligated to contact you back. So whoever asked that question, say who you are, get in contact, and somebody will get in contact with you in 48 hours.
Well, let me just give a 30-second answer to that, though, just to pique people's interest, that when kids have an actively involved dad, they do better in school. They are less likely to drop out of school. They're less likely to get involved in drugs and alcohol, less likely to have mental health issues, less likely to become teen parents on their own. They are much more likely to graduate college, go on to have professional careers. That's the tip of the iceberg. There is so much stuff. And unfortunately, a lot of that research comes from looking at the opposite of it. What happened to kids who don't have involved dads? But there's also a lot that's coming out that's showing that kids I mean, completely counterintuitive stuff too. Like, you wouldn't expect that kids who have an involved dad are actually more empathetic than kids who don't. They recognize people's feelings, and a lot of it comes to do with wrestling with dad. And you realize, there's only a certain number of times I can elbow my dad in the mouth before he says, "Hey, we're done. We're not playing anymore." And you learn to recognize other people's emotions. So that's the beginning of it. But do check with the clearinghouse, and there's a lot more.
And one of the most things that stands out that people don't pay attention to, you can almost track poverty in this country by male involvement. If you look at zip codes, and you take some of the highest poverty zip codes and some of the wealthiest zip codes, there's normally a difference between involved active males and males who are been marginalized or non-active or high levels of incarceration, those type of things. You can track success literally in this country by males.
Yes. So next question is, how do you counter situations when those in the father's inner circle discourages seeking professional mental health counseling?
Wow.
How do you
probably go level one? And anybody else want to take it as you can. Level one to me is, go to a fatherhood organization. We don't couch ourselves as quote unquote mental health professionals. The average fatherhood organization is dealing with health, economics, and relationships, and the things that surround those big three buckets. And that health is normally holistic. Economics is everything from, what's the job for you, how are your earnings, how do you increase your economic mobility, and relationships have everything to do with from parenting all the way to the healthy relationship with the co-parent. So sometimes if you go straight to the jugular with mental health, we do this. But we say, man, but if I'm going to assume, I could be dead wrong, I'm going to assume that maybe a lady asked that question. I would say this right here, probably focus on, hey, honey, I would love to have a better relationship with you. You could, you want to be resourced at being a better father, try this. Normally, if you go straight to the mental health, if in some cultures, they're going to be like, you think I'm crazy? you literally take a step back and say, find maybe something he wants to work on, and find the place and the space and the practice where you can work on that thing without dealing with mental health. And somehow the healing comes across that way. Sometimes when we run straight to that term, people do hit the Michael Jackson moonwalk.
We frame it. I just like to point out, if we're going somewhere in a conversation with somebody, it could be 15 minutes, it could be 3 hours for months on end. We wait, we time bringing up mental health, because we're not going to give someone is clearly giving any indication that he is not interested in hearing yet. So number one, timing. And number two is how we frame it. It's not necessarily you need a mental health professional because there's something wrong with you. We see this as advocacy, pure and simple. If somebody has a need and you can find an advocate for that person because that's too heavy a weight to carry yourself, this is somebody who's just for you, who's personal, private, confidential, but not free necessarily. But basically, here's your advocate, and this advocate is for you to figure out how to make decisions that are in your best interests, how to build your toolkit for when there's conflict and stress. This is really somebody who's gonna, there to assist you and not necessarily fix you. So I guess timing and framing are the two things that we would focus most on.
And I would always traditionally resort to, when it comes to, I know the question kind of led to family members who, or individuals who may talk fathers or men out of counseling, but for those men who have found themselves apprehensive, piggybacking on what Shari said, I've always reframed the concept of therapy for most men, you know, and I rely on that old Proverbs 27:17, like, hey man, iron sharpening iron, you know, one man sharpening the face of his neighbor. You know, this is just two guys, we're having cigar talk, or we're just, you know, we're just checking in with one another, right? To try to reduce the anxiousness or the fear of being able to be open and be vulnerable, and being non-judgmental in that space. So I always try to reframe it just to make the man, you know, a man more comfortable with coming in due to that power dynamic in that, you know, in that setting. So ensuring that, you know, guys are just, hey, this is just two guys checking in, you know, no judgment here. So being able to reframe is really impactful for most men, and I've noticed has allowed most men to be able to come in and feel a lot better with engaging in taking care or addressing their mental health issues. Yeah.
You know, there was the question about what about the people in the father's inner circle who are not encouraging him. I think we need to understand that the whole simple idea of the rising tide lifts all boats is an incredibly important one, and that if a mom, just to take on, if a mom is discouraging the dad from getting help, she's hurting herself. That the mom is going to be better off, and the friends and the community will be better off when the father has better mental health and can be a more actively engaged dad. Everybody benefits from that, not just the dad. So by discouraging somebody from getting help, you're really hurting yourself and everyone else around you.
That's right.
We do absolutely remind people, you need to block yourself off from other people's in your head, you know, telling you what you should and shouldn't do. Often it's based on that other person or the friends, whoever those people are, their bad experiences. So you know, basically kind of extricating the dad from that influence is also very helpful. Is just to kind of remind this person you are an individual, and anything that you do should be based on, you know, your thoughts about what your needs are, not what other people tell you.
Okay, all right. Next question is a bit loaded, but like, well, in complexity, but what part do you guys feel that systematic racism and socioeconomic disenfranchisement, as well as class, play into the part of mental health of men? And how is that taken into account when discussing mental health with men?
I could say that's part of the trauma-informed approach. For sure. There's vast recognition that is an extraordinarily negative influence on the world of mental health.
I would just say go slow. And what I mean by that is, part of a good approach is to come as psychologically and emotionally clean as you possibly can without putting any preconceived notions on it. Because, you know, what can happen is, and so I'm going down. So Corey, if I get off, you stop me. But I'm going down my therapeutic, you know, rabbit hole here. If the therapist has a lens, and the person he's seeing, if their lens match, it might not be a good fit, because some people are looking to be verified more so than to be healed. And if you verify me, then I leave with a excuse or a reason, and I don't necessarily leave with the healing that I necessarily need to mobilize past that problem. And so, and then, you know, everything that you mentioned in that question, Jerome, it's very different than it is from South Carolina to maybe a city like LA, where it's, you know, and so you got to be real careful with your approach, and not draw too many assumptions in there, and try to really come from a healthy place and make sure that you're not necessarily verifying and leading with an assumption, because you might end up doing more bad than good.
I mean, I would just simply add, as practitioners, just being mindful of potential biases, just to kind of piggyback on what Richard is saying, being very conscious, being very mindful of your own biases that, you know, you're bringing into those spaces. And when you are experiencing those potential biases, that you're getting adequate supervision, you know, to be able to have those discussions, you know, and referring clients if necessary, referring them out to practitioners that can help them with the needs that they are expressing due to those biases that you have, that you know, that you're aware of, that, you know, that's preventing you from being able to show up in the way that they need you to show up.
Okay, yes, we are out of time of answering our Q&A session. Any questions or anything that we have not gotten to, like, we will reach back or respond at a later date. And any resources or anything that we have gotten, I mean, that materials that we have shared will also be available on the website. So yes, thank you all. Well, Richard, did you want to close us out, or, well, actually, sorry. But yeah, I guess I'll close. But thank you all for participating in today's webinar. We would appreciate your feedback through a participant survey, which will be in the chat. And please take time to give detailed feedback and share any ideas via email at help@fatherhood.gov.info. And or also call at 877-4DAD or 411. And also, if you are interested, take time to join our virtual collaborative community at learningcommunity.fatherhood.gov. But yes, I will share the survey. But yes, thank you all for attending today's webinar.
Thank you.
Thank you, everyone, so
Thanks,
much.
everybody.
Yep,
you.
keep minding your mind, and don't let your mind undermine you.
That's right.
All right, take care.
Thanks.
Thank you.
Panelists, please stay on the line. Thank you.
Okay.
Okay.